Okay. Thank you very much once more time. It's a great challenge to participate in this conference. I'm from Batumi. Batumi is the south part of the Georgia of South Caucasus, and I'm very glad to take my attention one kind of the topic which is related with to the COVID-19 and also erythrocyte growth antigens. He's mentioned my co-authors, and these co-authors belongs to universities. This is Batumi Shota Rustaveli State University, which is located in Ajara region of the Georgia, and also School of Medicine and Health Science of Batumi BAO University, which also is one bigger university in my region. What about the introduction of my presentation? Of course, you know that SARS-CoV virus is a new challenge of the world, which respiratory virus that spread very easily, and in some cases have complications that can even be fatal. The SARS-CoV virus name is given by the International Committee of the Taxonomy of the Viruses, and there are several kinds of the potential risk factor for the SARS-CoV viruses. There are a lot of publications which show us a lot of risk factors and also susceptibility factors for the viral infection. There's also susceptibility of the viruses and also COVID-19 disease progression. Numerous medical and social demographic risk factors for infection is well identified. And here is shown this well-defined risk factors, for example, old age, pre-existing comorbidity, male age, also age, and also the gender complications and different kind of the risk factors for the complication of this disorder, also viral infection susceptibility. What about the additional literature show us that the risk factors evaluated process is increasing, which is the most important for the increased degrees of the prevention. Most important in these cases is the peripheral blood group markers, especially in latest information. It's are shown that it's are correlated with different kind of the antigens, which is the erythrocyte antigens and also the leukocyte antigens. This is the biomarkers which are studied in different kind of the disorders. They are determined by they are the genetically factors, the blood group antigens distributed patterns in not equal for these different populations. Different populations have different kind of the prevalence of these antigens, and there are a lot of review which show us that these antigens are the distribution of this antigen are related with to the infection disorders. Various environmental factors can change the distribution of these antigens. Among them, most selectivity factors and infectious disease, which are caused by several microorganisms and also several viruses. There are a lot of kind erythrocyte antigens. Among them are ABO, RH factors, so-called the KEL system, DAC system. There are approximately there are 29 erythrocyte blood group systems and at least 300 antigens. In infection relationship, it's linked with ABO blood groups because these antigens are erythrocyte present in erythrocyte surface, and in many literature it's found that frequency of distribution ABO blood group antigens is directly related to the epidemic infection disease such as a plague, cholera, and measles epidemic and pandemic alters gene geography of blood groups. We are reported that blood group antigens are the cellular receptor for the microorganisms and viruses, and in some cases they are the additional receptors for attachment of the virus, and some blood group persons have more susceptibility for the susceptibility for diseases, progression of the diseases, and also viral infections. The current study aim is to investigate the relationship between blood group and the SARS-CoV virus to susceptibility and also COVID-19 disease severity. There are a lot of literature which show us that these antigens are related with SARS-CoV infection in different populations. Of course, first information comes from the Chinese population, and in Chinese population was shown that on the O blood group patient was lower distribution than in control groups. The Spain population study shown a major high risk of SARS-CoV-2 infection among A blood group persons to compare with other blood group patients. The authors suggested that O blood group have protective effects. There are also high cohort study in Danish population, and also this publication show us that ABO blood group antigens are the risk factor for the SARS-CoV-2 infection. The total 7,422 Danish individual studies shown the reduced prevalence of the SARS-CoV-2 infection in the O blood group. On the other side, these authors and the co-authors try to find the relationship between hospitalization and death from the COVID-19 and blood groups. But in this publication, it's shown that this link is not found. In Canada, population study showed anti-A antibodies, which is present in case of the B blood group and also AB blood groups. They are protective effect against SARS-CoV-2 infection. Data indicates that COVID-19 patients with A or AB blood group are at risk factor for mechanical ventilation requirement than patients with O and B blood group. The A blood group persons in most cases did not require artificial respiration. Patient who requires artificial respiration in most cases were persons with O blood group. The B blood group patient in the lowest percentage experienced myalgia. They need more than 3 weeks to recover. Based on this data, O blood group people had a lower chance for SARS-CoV-2 infection, but they need more treatment period in hospital, and also artificial respiration is a more needed procedure for them compared to other blood groups. What about the Arab community study? The data for Arab community study show that SARS-CoV-2 infected person majority were A blood group, and in most cases the saturation range of oxygen was 90 and 100%. All blood group person infected rate was reduced, but on the other side, oxygen saturation range were less and equals 70 and 80. This all information give us information that ABO blood group antigens have a link association with infection, especially in SARS-CoV infection, because here it mentioned in this slide that 14,120 individuals tested for the SARS-CoV to the infection from the New York Press hospital system. We are used to study materials for finding possible association between AB and also Rh blood factors and SARS-CoV-2 infection, intubation, and also death. The authors found an increased prevalence of SARS-CoV-2 infection among persons with non-O blood group. This is A, B, and AB blood group. The intubation risk was a little decreased for persons with A blood group and slightly increasing the person which have AB and B blood group compared with O blood group. The study showed also the death risk increase in person with AB blood group. The proportion of the death was less in A and B blood group cases. However, we also find alternative studies. Alternative studies, there is not any link between ABO blood group, Rh blood group system, and also disorders, not disorders, infection and the COVID-19 diseases. The study which look at 10,000, not 10,000, 107,796 individuals in the USA population showed that blood types were not correlated with SARS-CoV-2 susceptibility or COVID-19 disease severity. Similarly, B and AB types were not correlated with worse outcomes compared to the O blood type. Similar data are given from the some co-authors. The authors were evaluated the association of the hospitalization, intubation, and death risk to the blood group. They did not find an association between AB blood group and also implementary markers. There was no correlation between clinical outcomes of the severities of the COVID-19 and also ABO blood types. Also, ABO blood type was not related to the risk of intubation or death in patients with the COVID-19. What is the research materials? We studied a total 444 blood samples. Among them, 333 of belonged to the patient who was post-infected with SARS-CoV-2. And also we take the materials from the control groups. Who was the control groups? Control groups was the persons who was not infected with the SARS-CoV infection. In majority cases, in control groups, we take the persons which was not infected, but they have high risk for infection. They have family members, friends, classmates, roommates, or others infected persons. They had contact with infected person, but in current study period, they was not infected. At that time period, when we studied this relationship, they were not vaccinated because the vaccination process started more later in here. A large proportion of the studying patients are females, while 98 individuals was were males. The material was taken from the clinical laboratory of some in Ajara region, and some of them was the voluntaries post-infected persons. The study also including voluntaries who were infected with SARS-CoV infection and also recovered. The age range of the SARS-CoV-2 infected post-infected person is from 8 to 87 years. Prior to data collection, patients were provided with information about the current study. They were informed of the purpose of the study and substantiation in writing the content to participate in this study. Materials were collected in 2021 and time period, which is mentioned here. Why I mentioned this time period? Because at that time, vaccination process was not started in my countries, and all persons which is including in this survey was not in vaccinated. A special bilingual questionnaires were prepared for the patient involved in the study. This was Georgian and English questionnaires. The questionnaire includes various items. Study participants went through the interview phase, and after that they filled this questionnaire and recorded their writing contents. Research methods, blood typing of the stem cell being carried out the basic of the immunogenetic laboratory of the Batumi, Shota, Rustaveli State University, and also BAU International University, Batumi. In order to relieve the specific antigens of erythrocyte blood group plasma as well as the erythrocyte mass have been applied. We use different kind of modification of the blood typing methods, especially we take the monoclonal antibodies. By using these monoclonal antibodies, we can detect the antigens in the surface of erythrocyte, and we can phenotyping the blood groups. And in case of the weak antigens, we use the some magnification lenses, microscopes for see weak agglutination property. And also in some cases we have the tubular tubes process. So we can find the negative reaction and agglutination are evaluated in different grades. For example, grade 1, grade 2, grade 3, and grade 4. And by using this methodology, we are properly determine weak and strong antigens. What about the result which we take? We obtain. This is shown in this picture. ABO phenotypes, groups, and susceptibility of the SARS-CoV-2 infection. The chi-square is then 9.1 and p-value is 0.02. In this picture is shown the blue color is the control, and what about the red color is the infected person. Based on this information, we can see that in infected person was high prevalent. It appeared the A blood group. But what about the O blood group? O blood group show less frequently prevalence property to compare other blood groups. This was compared to studied in the control group to each other, but we also use the for the controlling regional distribution of the blood groups and blood groups in donors. We have property to take this information because in our previous study we studied the regional distribution of the blood groups, and also including this regional distribution 498 persons. And what about in blood donors in region? It was 1009. And in all cases, in control groups, the less distribution was the A blood group, and in infected persons, this A blood group prevalence was increasing. Oppositely, we can say about the O blood group. O blood group was less distributed in post-infected persons. We can make conclusion that O blood group is less susceptibility with SARS-CoV infection. And what about the A blood group? It's our most susceptibility with the SARS-CoV-2 infection. What about the RH factors? RH plus and RH negative phenotypes. In this diagram are shown that if we take our attention these two groups, RH plus and RH negatives, we cannot find any correlations regarding this part, and oppositely to the literature, separately only these RH blood groups are not linked with the SARS-CoV infection. But we make the combination with ABO blood group and RH factors. Among this one, we take the 8 combinations, and these 8 combinations are ORH plus, ORH negative, ARH positive, ARH negative, BRH positive, BRH negative, ABRH positive, and ABRH negative. If you see from this diagram, these are for the control population, and these information are given for the post-infected person. And differences we can find only 2 groups. This is the ORH positive and RH negative. If we compare these 2 characteristics to each other, we can make decisions that in control groups, majority of are present ORH positive. But what about the post-infected persons? In post-infected persons, here high level is appear ARH positive. But what about ARH negative and in control and in post-infected population are equally distributed? We can make conclusion ABO and RH system combination study. We are relieved that prevalence of ORH plus phenotype in control group was 42.9. That was 9.9 higher than the prevalence rate of the same phenotypes in the SARS-CoV-2 viruses, post-infected groups. ORH negative phenotypes group was prevalent with almost 1.4 times lower frequency in post-infected individuals, and chi-square of this is the 33.69, when the critical volume is 40.7, and degrees of freedom is 7, and P is equal less than 0.05. Thank you for your attention. If you